Hello everyone. Today we will talk about Muhammad Ali, who was American boxer who suffered from this disease himself. Well, this disease can be due to trauma, and as you can see, we are also talking about Muhammad Ali. But why? Because in boxing or any other sport like martial arts where there is no protective headgear, so due to no protection and repetitive punching overhead will lead to microscopic bleed in the basal ganglia area, due to which there will be bradykinesia, which is also a symptom itself, and bradykinesia is slow body movements. So, being a famous boxer player, he also suffered from this disease. And today we will talk about Parkinsonism. So first of all, I will discuss about the clinical features. And the clinical features are, as you can see, this old male, he is around 60 to 70 years old, and the features are masked facial expression. There will be forward tilt of the trunk, reduced arm swinging movement, and shuffling gait with short stepped gait, trembling of extremities, the rigidity, and the stooped posture. These all are cardinal symptoms of the Parkinsonism. But the triad, the main symptoms which will detect Parkinsonism are tremors, bradykinesia, and rigidity. So, if we talk about tremors, the tremors are resting tremors. That means during sleep, these tremors disappear. And the rigidity itself is severe, which might lead to akinetic mutism. In akinetic mutism, there will be no voice or no will to speak. The person himself cannot speak due to rigidity of vocal cords. And in Parkinsonism, why this disease take place? Due to decrease in levels of dopamine in substantia nigra, which is part of the brain, and decrease in the dopamine levels will lead to the Parkinsonism. So, in this diagram, you can see in a normal neuron conduction, due to the presence of dopamines, there will be normal movement taking place. But in Parkinson's affected neuron, due to depletion of the dopamine level, movement disorder takes place, which are tremors, slow movement, and rigidity. Parkinsonism itself is due to Parkinsonism disease, and this disease is a neurodegenerative disease which is genetic and will be seen in old age group for around 60 to 70 years old people commonly. So, after which we will talk about the symptoms in detail. First is the resting tremor, in which there will be pill rolling movement, which is seen in the thumb and index finger. Then there will be postural instability, due to which the person might fall again and again in backward direction. So, due to this patient cannot stay alone. While examining the patient in a clinical setup, when we ask him to walk from one point to the other, the normal person will walk easily in a normal speed. But this person, after giving command, still he might not be able to walk, and due to this time lag, the person will take enough time to reach the point. Till that time period, after telling him to stop, you might ask him to take a U-turn. But while taking a U-turn, you need to stand with him because he might fall. So, even the person cannot eat nicely, his eating habit will be messy due to the jerky movements of the hand. The food will fall on him every time. And another point, Meyerson sign will be seen, which is every time you tap on the glabella, his eye will blink. But in a normal person, after one or two times, there will be no blink in the eye. So, the treatment of this disease is levodopa. But the levodopa cannot be given alone due to its side effects. So, levodopa is given with carbidopa in a fixed dose combination.